L3 because of the other tissues on the top of it. But like you can kind of landmark a little bit like where is the here, and it's gonna be 3, 4 around this area, right? And from the femoral nerve, it branches off, and then it goes to the medial side of the thigh, and then it goes to the posterior medial side of the knee, and goes all the way down to the medial side of the lower leg. And when you find their medial malleolus, it goes anterior to the medial malleolus and goes all the way to the great toe area. So from L3 and 4, and the femoral nerve branch off from there and goes all the way down, a little bit to your around like this way, and then goes all the way down on the medial malleolus, and then to the great toe. Okay? And for the sciatic nerve, it's on the posterior side of the body. So from L4 to F3, right? So you're gonna find like this sciatic, 2 and 4. So it's from like all the way down here. And then you need to get a consent from your patient because you're gonna cross their bottom area. Do I have it? Yes. And then you need to landmark a little bit like gluteal, greater tuberosity, and then there is ischial tuberosity, right? And then sacrum is here. And you're gonna have the curvature in between those area and goes down along. And when you reach to the lower third of the thigh, then it's gonna become tibial and then the common turn, right? So it's actually it's really short here from the root L4 to S3, and then lower, and then become the tibial and common. And for the tibial nerve, it's gonna be from L4 to S3 to same root, and then from the sciatic nerve, and it become the tibia when you pass the 1/3 of the lower part of the thigh, and then for the posterior compartment of the muscle, and where it goes is it goes to lateral or medial. It should go to the medial. So and when you go along down, it's gonna go to the posterior to the medial malleolus, and when you pass there, like and then it goes to the bottom side of their foot, and there's a medial and then the lateral plantar branches, right? So from like L4 to S3, and there's a sciatic, and it becomes tibia, and posterior to the medial malleolus, and then to the bottom side, there are 2 branches, medial and lateral. Okay? And then the side. So there's a common peroneal nerve from the sciatic, right? So when you are tracing the peroneal nerves, you should start from where it is. It's the root right here, L4 to S3, S2 for that one. And then from the sciatic, after you pass the lower third of the thigh, it becomes the common peroneal. And then you're gonna look for where the neck of the fibula, and when you reach to that area, it spread, become like superficial one and then the deep one. So when you're tracing those 2 from the common peroneal, there's a deep, it goes to the anterior compartment of the muscle, right? So you can almost tracing like the tibialis anterior muscle along, and there's a different branches like medial, lateral, and then the one goes to the joint. And for the superficial one, just there. And it's the lateral compartment of the muscle that is innervated by the superficial one, right? So from the common peroneal at the neck, and then it goes along down the lateral compartment of the muscle. Now you need to go to the anterior to the lateral malleolus, and there are 2 different branches, lateral and medial. We're gonna see one more time. So from the common peroneal, anterior one, there are 3 branches, and then the superficial one. There are 2 branches. There's an overlapping area. It's not too bad, eh? These are all. Are you guys ready to practice?